Calcium is one of the most essential minerals in the human body, crucial for bone strength, muscle function, nerve transmission, and even blood clotting. Yet, many people fail to get the proper amount of calcium their bodies require. This article explores the early warning signs of calcium deficiency, the common causes behind back and neck pain, and the most effective and sustainable ways to supplement calcium, particularly for the American population, signs of calcium deficiency, and the critical need for supplementation. People suffer from a calcium deficiency without realizing it. Some of the earliest and most common symptoms include tingling or numbness in the hands, feet, or around the mouth, along with frequent muscle cramps or spasms. However, it is important to note that not everyone with a calcium deficiency will exhibit these clear signs. For some individuals, the deficiency remains silent until it leads to more severe conditions such as osteoporosis or bone fractures. Modern dietary habits are partly to blame. Compared to past generations, the nutritional quality of today's food has declined due to industrial farming, soil depletion, and food processing. Many common meals are high in calories but low in minerals, including calcium. As a result, it has become increasingly difficult to meet daily calcium requirements through food alone. For most individuals, it is advisable to supplement calcium daily to ensure the body has enough of this vital mineral. Generally, to calcium tablets per day equivalent to about 1,000 to 1,200 milligrams can help bridge the dietary gap, though this amount may vary depending on age, gender, and individual needs. Causes of back and neck pain and practical solutions. Millions of Americans suffer from chronic back and neck pain. While the causes are often complex and multifactorial, there are three primary contributors worth examining: lifestyle habits, poor diet, and stress. One lifestyle habit. One of the most common reasons for musculoskeletal pain, especially in the neck and lower back, is prolonged sitting and a sedentary lifestyle. Sitting for long hours, whether at a desk, in front of the television, or during commute, puts undue pressure on the spine and weakens the muscles that support posture. Inactivity also limits exposure to natural sunlight, which plays a crucial role in helping the body produce vitamin D3. Without sufficient vitamin D3, the body struggles to absorb calcium efficiently, regardless of how much is consumed. Regular physical activity, including weight-bearing exercises such as walking, hiking, and strength training, can stimulate bone-forming cells and reduce bone resorption. This not only helps prevent bone loss, but also alleviates some of the tension and stiffness commonly associated with back and neck pain. 2. Improper diet. A poor diet high in refined carbohydrates, processed sugars, and industrial seed oils like soybean, corn, and canola oil can lead to systemic inflammation. Chronic inflammation accelerates aging, weakens the body's structural integrity, and contributes to the leaching of calcium through the kidneys. Furthermore, many modern foods are severely lacking in essential minerals. The emphasis on convenience over nutrition has resulted in diets that are insufficient in calcium, magnesium, potassium, and other important micronutrients. When your diet fails to meet your calcium needs, supplementation becomes more than just an option, it becomes a necessity. 3. Stress is another hidden culprit in the depletion of calcium from the body. When under stress, the body's breathing rate increases, causing a loss of carbon dioxide. This shift elevates blood pH, making it more alkaline. In response, the body pulls calcium from the bones to help rebalance the pH level, ultimately weakening bone density. Managing stress effectively is essential for maintaining bone and joint health. Techniques like slow, diaphragmatic breathing and consistent breathing rhythms such as those used in the Coent breathing exercise can stabilize blood chemistry and reduce calcium loss. In addition, walking barefoot on natural surfaces like grass or sand has been shown to reduce free radicals in the body, support mineral absorption, and improve musculoskeletal balance. For golden rules for optimal calcium absorption to ensure that your body gets the most from your calcium intake, whether through diet or supplements, it's important to follow these 4 key principles. 1. Practice proper breathing techniques. Maintaining a stable internal pH is crucial for bone health. Shallow or rapid breathing patterns can disrupt this balance. By practicing slow, deep, and diaphragmatic breathing, you help stabilize blood pH, which reduces the need for calcium to be pulled from bones. This seemingly simple habit can have a lasting impact on your overall mineral retention. 2. Supplement with calcium's allies, vitamin D3. Vitamin K2 and magnesium. Calcium does not function effectively in isolation. It requires cofactors to be properly absorbed and utilized. Vitamin D3, which your skin produces in response to sunlight, is essential for intestinal absorption of calcium. Ideally, people should aim for moderate sun exposure daily, especially during midday hours. Vitamin K2, found in fermented foods such as natto, aged cheeses, and sauerkraut, directs calcium into the bones where it belongs and prevents it from depositing in soft tissues like arteries. Magnesium is another critical player, as it helps activate enzymes involved in calcium metabolism. Leafy greens, nuts, seeds, and whole grains are great dietary sources, though supplementation may be needed if your intake is low. 3. Choose easily absorbable organic calcium. Not all calcium supplements are created equal. Organic calcium, which comes from food-based sources such as algae, seaweed, and eggshells, is generally better absorbed and less likely to cause constipation or kidney stones than inorganic forms like calcium carbonate. These natural sources are more compatible with the human digestive system and often contain other trace minerals that enhance calcium's effectiveness. When choosing a supplement, look for ones labeled as plant-based or food-derived. 4. Start supplementing early in life. Many people only start worrying about their bones later in life, often after the first fracture or osteoporosis diagnosis. However, bone development peaks during childhood and adolescence. The period before the age of 8 is considered a golden window for bone mass accumulation. Establishing good calcium intake early on can have lifelong benefits. Encourage children to consume calcium-rich foods and spend time outdoors in natural sunlight. Doing so can build a strong foundation that will support bone health well into old age. Frequently asked questions about calcium and bone health. Is bone and joint disease hereditary? While genetics do play a role in determining your risk for osteoporosis and other musculoskeletal conditions, they are not the only factor. Bone and joint health is influenced by 4 main elements: genetic predisposition, nutritional intake, daily lifestyle habits, and physical activity levels. So, even if you have a family history of bone disease, adopting a nutrient-rich diet, staying physically active, and minimizing stress can significantly reduce your risk. Can individuals with gallstones take calcium supplements? Yes, they can, particularly if the calcium is organic and food-derived. Unlike synthetic or inorganic calcium supplements, which may aggravate gallstone formation, natural forms of calcium are better tolerated by the digestive system. If you have gallstones or a history of digestive issues, consult with a healthcare provider before starting any supplement regimen. Still, in most cases, organic calcium poses minimal risk and offers substantial benefits. Is it safe to take calcium in the evening? Absolutely. In fact, taking calcium supplements at night can be particularly beneficial. The body's calcium levels tend to drop during sleep, which may result in muscle cramps or restlessness. Supplementing before bedtime not only supports overnight bone regeneration, but may also improve sleep quality by calming the nervous system. Just be sure not to take calcium with high iron meals or supplements, as calcium can inhibit iron absorption. Final thoughts: calcium is far more than a simple mineral for bone strength. It plays a foundational role in almost every system of the human body. However, many Americans fall short in their intake, putting themselves at risk for bone fractures, chronic pain, and degenerative diseases. By understanding the signs of deficiency, addressing contributing lifestyle factors, and following scientifically backed supplementation strategies, you can protect your long-term health. Whether you're a parent hoping to build your child's bone strength, an adult experiencing back pain, or a senior concerned about osteoporosis, calcium supplementation done right can be a game changer. Prioritize your health by making informed choices. Your bones will thank you.